Hello everybody. Welcome to No1doctor channel. Today we will talk about one of the famous doctors, Wilhelm Heinrich Erb, 1840 to 1921. Erb's paralysis. Wilhelm Erb, a leading neurologist of his day, was born at Weinweiler, in Bavaria, in 1840. His father was a forester. He commenced his medical studies at the University of Heidelberg, continued them in Erlangen, and received his medical degree at Munich in 1864. After a short period spent in the study of pathology, Erb returned to Heidelberg and rapidly gained a reputation as an original worker and writer. In 1880 he was appointed professor of medicine at Leipzig, but after 3 years he returned as professor to his old University of Heidelberg and remained there, in spite of invitations to other centers, to carry out his important researches. In 1886, Erb introduced the use of electrical stimulation of nerves in both diagnosis and treatment of neurological problems. He published textbooks on diseases of nerves and of the spinal cord and on the muscular disorders. He introduced the now everyday term the tendon reflex. In 1874, Erb published a classic paper entitled Concerning an Unusual Localization of Brachial Plexus Paralysis, in which he describes 4 examples in adult patients of lesions involving the roots of C5 and C6. In addition, he added the case of an infant, delivered 2 months previously after version and subsequent forceps extraction. He stated it is probable that the lesion in the cases mentioned was localized to the 5th and 6th cervical roots, or at their anterior branches, or at the junction of them both. Erb's studies on neurosyphilis, the muscular dystrophies and myasthenia gravis were also of great importance. Not only was Erb a great investigator, he was also a brilliant diagnostician and clinical teacher. He died in 1921, at the age of 81, of a cerebral hemorrhage, which he suffered while attending a classical music concert. Thanks for watching. Hope to see you again in more next videos. With my best wishes. Dr. 8 Famid.